and then as people, we'll get started, and then as people come in, we'll let them in. And can you all see my screen?
Yes.
Okay, perfect. Well, hello everyone. Welcome to today's Kidney Health Coach Virtual Collaborative. We're so glad you can join us, and we're excited to share some exciting updates and announcements with you all today. Before we get started, please feel free to introduce yourself in the chat. Let us know where you're joining us from, your name, and how long you've been a coach. So before we get started, we always like to do an introduction of the Kidney Health Coach team at American Kidney Fund, and you may see some new and familiar faces. So we'll just go around to do some quick introductions from the team. I'm going to start us off. Hi everyone, my name is Sana Sadiq, and I'm the Public Education Specialist here at AKF. I'm going to pass it over to Ryan.
Thanks, Anna. Welcome, coaches. My name is Ryan Woolley. I'm the Senior Director of Public Education. It's good to see you all. And I will pass it over to Joy.
Right. Thank you so much, Ryan. Hi, everyone. My name is Joy Hall. I'm the Senior Director of Outreach and Strategic Partnerships. So I'm glad to be here today and join you all in today's collaborative call. I'm going to go ahead and turn it over to Ria.
Hello, coaches. I'm Ria Suarez, Director of Outreach and Strategic Partnerships. It's so good to see everyone on the call today. And I will pass it to Asia.
Good afternoon, everyone. My name is Asia Mason, and I'm an Associate Director of Outreach and Strategic Partnerships. I'm so excited to be on the call today. I've been looking through the chat to see where everyone is from, and thank you all for being here today. I'll pass it to Ama.
Hi, everyone. I'm Ama Seichi, and I am an Outreach and Strategic Partnership Specialist. I'm excited to meet you all. Sana, back to you.
Thanks, team. And I'm going to just go ahead and check the chat to see who we have joining us. We have Guadalupe from Dallas, Texas, who's been a coach for 3 months. We have LaRonda, who's been a coach for 1 year from California. We have Andrella Woody, who's from Birmingham, Alabama, 3 years as a coach. We have Jackie, Brenda Pratt from Riverside, California, Lorna from Hawaii, Tracy from Olney, Maryland. Thank you all for introducing yourself. Welcome. So if this is your first time attending a collaborative, welcome again, and thank you for joining us today. We host these virtual collaboratives to offer an opportunity for our coaches like you to come together, connect with each other, and connect with AKF staff. And it's an opportunity for you to expand your knowledge and skills in kidney disease and health education related topics so that you feel better supported in your efforts to educate others in your community. To make sure that the topics we cover are relevant to you as a coach, and we always want to help improve these future trainings. At the end of the call, we'll ask you to complete a short evaluation survey. Please take a moment to complete that. Your feedback is really important, and we also like to hear about the topics that you may be interested in. I'm going to take a quick look at the chat again. We have Sade from Arkansas. Thank you for joining us. All right, so the agenda for today's call, we're going to start off with, starting next, we're going to highlight some of our accomplishments from the past year. We'll provide a quick overview of APOL1 mediated kidney disease, or AMKD. It's upcoming Awareness Day in April, and then education resources you can share with your community to spread awareness, including who may be at risk for AMKD. Then we'll screen share and do a quick walkthrough of our updated Kidney Health Coach online portal and new resource library for available resources. And then we'll also have an open Q&A for all of our coaches. We'll answer some of the questions that we collected in registration, but feel free to add your question in the chat, and we'll try to get to as many as we can towards the second portion of the call. And then we'll close out with some announcements. All right, we just want to take a moment to highlight our 2024 highlights and accomplishments, and really take a moment to recognize all of the great work and impact on communities that we really could not have done without you. Currently, we have over 6,800 coaches across the country who are dedicated to educating their community about disease prevention and management. We really look forward to growing this number of coaches. We also concluded the pilot cycle of the health equity grants, where 28 coaches in 4 organizations reached and educated over 18,000 people, including Black, Hispanic, Latino, Native American, and Asian Pacific Islander communities who are disproportionately at risk for and living with kidney disease. We also kicked off a second cycle of the health equity grants with 19 coaches in 4 organizations. And then we also created new resources for coaches, including conversation starters and a guide for our healthcare professionals. So once again, thank you for all that you do, and we could not do this work without our coaches. Okay, and now I'm going to pass it over to Ryan to give a brief overview of APOL1 mediated kidney disease, or AMKD, and resources.
All right. So we have an upcoming APOL1 mediated kidney disease, or AMKD, Awareness Day at the end of April. So in preparation for that, we just wanted to share some information about this disease, and also talk about some resources that we've curated for you as coaches to use in your communities. So APOL1 mediated kidney disease is a genetic condition associated with mutations or changes in the apolipoprotein L1, or APOL1 for short, gene. If you have 2 of the APOL1 genetic mutations, this can put you at a higher risk for developing kidney disease and kidney failure, and it is a progressive form of kidney disease, meaning that it progresses to kidney failure faster than usual. And people that are Western or Central African descent are more likely to have these APOL1 gene mutations. And this includes people who identify as Black, African American, Afro-Caribbean, and Latino or Latino. And the only way to know if you have the APOL1 gene mutations is to do genetic testing. So we had, go on to the next slide. Last year around this time, we did a whole collaborative presentation on APOL1 mediated kidney disease. We had Dr. Norman Silas join us to share more details about what the condition is and information for our coaches. And so now this year, as part of preparation for our National AMKD Awareness Day, we'd like to ask coaches to now go out and share information about this condition within your communities to help us raise awareness in preparation for the day. And our slogan is to become APOL1 aware by knowing how your genes impact your kidney health. So with this Awareness Day and the associated campaign, we've created a lot of awareness materials like the image here for social media to share. We have guides and infographics to help raise awareness about this condition. And then we also have created specifically for you as coaches an education PowerPoint presentation. It's a shortened version of the Kidney Health Coach presentation that we have, specifically talking about this condition. And our ask of all of you as coaches is to use this PowerPoint, use the guide, use the infographics, and help to educate your communities about AMKD and raise awareness, especially leading up to the Awareness Day on April 29th. So what we've created is a Dropbox folder of all these different resources curated for all of you. And thank you, Sana, for dropping it in the chat here. So in that folder, you'll find the recording of our collaborative call from last year. So if you missed that call or just want to get re-educated on what AMKD is, you can go and look at that recording. We also have the PowerPoint presentation in English and Spanish, several of our guides, and an infographic, and some just educational resources that are available on our website as well. So we're really excited to get the awareness messaging out there, encourage people to be aware of their risk for AMKD, and just continue to share this information within your communities. And we're also offering coaches that attend this collaborative call an option to print the resources that we have available upon request. So there's an email address there, education@kidneyfund.org, where we're taking requests from all of you if you'd like to have printed copies of the resources that you can share with your community. Please email us and let us know, and we'll and let us know how many copies you'd like as well, and we'll get those printed and shipped out to you. Our goal is to get them to you as soon as possible so that you can help raise that messaging ahead of April 29th, or Awareness Day. And I'll just pause there if there are any questions that you have on the condition or the plan to raise awareness. I'm happy to answer.
Thanks, Ryan. I'm actually going to drop a link to an order form in the chat, and I'm just going to ask if you are interested in receiving some of the copies to use the online order form. It's a SurveyMonkey form. You'll be able to share your mailing address and how many copies you'd like to receive. And so we encourage you to take part in the opportunity. We're going to offer it until our supplies last. It's going to be, first come, first serve. So we ask that you request material sooner.
Thank you, Sana. And we'll continue, as leading up to the Awareness Day, we'll continue to share messaging that AKF has, for social media that you can easily copy and paste and share with your either Instagram, Facebook, LinkedIn, different social audiences as well. So any way that you can help us raise awareness, we would greatly appreciate it.
Thanks, Ryan, for that important information. And again, if you have any questions about AMKD, it's Awareness Day, or you can reach out to us, or if you have questions in general, you can add them into the chat for the Q&A. And we'll follow up with all attendees from the meeting with the link to the Dropbox folder, but also the SurveyMonkey copy request form so that you can access it and request it in time. Okay, so with that, we are gonna jump into screen sharing the new online portal, or the updated online portal and the new resource library, and kind of give a brief walkthrough or overview of all of the available resources that you as kidney health coaches have access to. I'll share all the links in the chat, but we really recommend you bookmarking these pages so that you can easily access the resources and refer back to these pages to stay informed of new updates or if there's new resources and announcements. So I'm going to add the links in the chat. All right, perfect. So we're going to start off with our new resource library. This is where you can access the key essential coaching resources, and a great place to get started if you are a newer coach and need resources, or just want to get some more information on how to get started with hosting sessions or activities. We recommend our coaches to start by downloading our Getting Started guide, which has tips to plan and prepare sessions, strategies to help find and engage your audience, and useful tips for hosting virtual sessions. Next, we have our Clear Communication Guide in English and Spanish. This guide is intended to help share communication resources to our coaches and help you learn some communication strategies like the importance of plain language, for example. And the reason why clear communication is so important is so that the people that you are educating can understand the information you're sharing and are better informed about their health and the steps that they need to take to keep their kidneys healthy. We also have our education session presentation slides. These are ready to go, ready to share with all of the content. It contains all the content in them. So these are presentations that you can share with your community. You can, if you are doing like a virtual session, you can screen share these PowerPoint slides. They're available in English and Spanish. If you're in person, you can use these slides as well. But overview of the presentation is it's a language for lay audiences. So it's a very general overview of what the kidneys are, what they do, what is chronic kidney disease, and treatments, what you need to know to prevent progression to kidney failure. So these slides are available in PowerPoint and PDF, and you can use them you can download them and use them to include your own journey or story. If you have some of your own resources to share, you can add them into these slides, or you could just use the information in the slides as a key talking point. We also have an evaluation, which we encourage you to share with your attendees or anyone that you just shared kidney disease information with. And this is where that they can provide feedback. And that's really important to us as it helps us improve the program and resources. The attendee survey is available through an online form. It's English form or a Spanish form, and you can use that. You can share the URL with people, or you can create a QR code of the attendee evaluation and encourage people to complete that. Or we did just recently make it available through a print copy version. So if you wanted to, you could download the printed copy and print them on your own and distribute them to attendees in person for them to complete and share their feedback. We also have our conversation starters with key points for preventing and managing CKD. These resources are helpful in case you know you're going to have limited time talking to someone or a group, and you want to make sure that you are addressing key points or key takeaways on those topics. And you can browse other available resources in English and Spanish. We have that AMKD community presentation that Ryan had mentioned earlier. We have our overview guides, symptoms infographic, and social media toolkit. We also have flyers and virtual backgrounds. You can download and you can edit the flyer to add information to promote your event. And the virtual backgrounds you can use, like I have the one on Zoom here, you can use them if you are hosting sessions on Zoom, on Teams, Facebook, anywhere that you are active. And then we have resources for healthcare professionals that do use Kidney Health Coach with their patients. The guide includes information on how to better understand patients' backgrounds, questions that you can ask your patients. We have Kidney Kitchen Pro, which dietitians can use to share nutrition resources and create and share meal plans using kidney-friendly recipes that we have on our Kidney Kitchen resource, and compile these resources that we share as toolkits and share them directly with their patients. So that is our resource library. Oh, and then we have some those resources that I mentioned also available in Spanish. That is the resource library. So again, we've shared that link in the chat. I encourage you to bookmark it and save it and refer back to it as you need. I'm going to now go over the session log that is on the Kidney Health Coach portal. All right, so when you're on the Kidney Health Coach portal and you scroll down, it's going to be the first button right here, log your educational activities. We're going to go ahead and open the form. So this form is really helpful to us because it gives us insight on how you share your materials and resources. And so we ask that you log your sessions and the way you share information throughout the year using this form. Like I said, it gives us insight on how you share the materials, but it gives you an opportunity to share program recommendations and improvement suggestions. It also helps us track how and where our coaches are educating their community and also how many people they approximately reach. So that's important for us to, help measure program reach and impact. And you can also, I'll show you how to complete the form and some of the prompts, but it's also an opportunity for you to add pictures of you hosting your sessions and activities, which is always great information for us to see, and we share that to inspire other coaches as well. So you just start off with providing some information about yourself, the year that you conducted education sessions. So because this is for the calendar year, you're going to include information about sessions you conducted in 2025. How many sessions, and when it's asking for numbers, it may be hard to remember exact numbers of your sessions. So we ask that you provide your best guess or estimate. We ask about the language that you conducted sessions and shared kidney disease information. This was important for us, and again, gives us a better idea and understanding of the communities that you may be reaching. Please indicate where you hosted your sessions and you shared kidney disease information. So our coaches are anywhere and everywhere. So, include your settings and the ways that you shared, or the places you shared information. These are just some common examples. And then we want to know the number of times you shared kidney disease information in each of the settings that you selected, and the question above, which kidney health coach materials you used when hosting sessions. So we have our flip chart, our PowerPoint presentation, fact sheets as just some examples. But we want to know what materials you used. And then the extent of how you use those materials and the curriculum to educate your community members. We'd like to know on average how many people attended each of your sessions, and then hear from you on how you felt the presentation went and how you felt that the audience received it. And then again, an opportunity for you to provide improvement suggestions as well as some pictures if you wanted to include. So once again, we do send reminders throughout the year, especially towards the end of the year, for coaches to come back and revisit this form to provide information of how they shared kidney disease information. Like I said, it's really important for us and gives us that feedback from you, and you are the coaches who are doing work in their communities and educating people and using our materials. So we want to hear from you as well as the people that attended your session. So that is the log form, and I will add it into the chat if it is not already on there. Oh, thank you, Ria, for adding it on there. We have a question. Guadalupe asks, is this something we fill out after each session or just once a year? So we do send reminders. Typically, we do a push like towards the end of the year. If you have the information of all your sessions that you conducted in the year, you can use the form to give information all at once for the year. But you can also come back and complete this form multiple times. So it's not just you can provide more than one response in case you wanted to. If it's easier for you to split it up as like the first half of the year, the second half of the year, you can do it that way. And we will share the links to the portal resource library as well as the log form with all of our attendees after the call, as well as to all of the coaches. And you'll see reminders in the newsletter groups if you're part of the Facebook group. So you'll definitely see these resources and the form again. So we can go back into our presentation. All right, so now we'll go into our Q&A. We did get some questions in advance, but please feel free to add your questions in the chat. And we'll try to get to as many as we can. But I'm going to start off with some of the by answering some of the questions that we did receive in advance. One of them was from a coach: how can I find other coaches in my area? And so this is a great question, one that we get asked a lot, especially from some of our newer coaches or coaches that are just now getting started and want to know like where in their community they can host sessions, or if there's a coach that's local to them too, maybe they can partner with them or use some of their audience as well as a starting point. So the virtual collaboratives are a great way to chat with other coaches. You can, exchange your information, your email address with others in the chat if you find that they are local to you. And then if you are not already a member of the Kidney Health Coach Facebook group, do join it. I will make sure that that's added into the chat, but and we'll follow up with a link too afterwards in case you're not a member. But it's a great place to connect with and network with other coaches. And then not only networking with other coaches who may be local, but you can also use that online community to ask coaches questions, share your own resources, and promote your events too. I'm going to go ahead and add that into the chat. And then also we did get a question about, a few questions about receiving marketing and print materials for Kidney Health Coach. So in the past, we have offered Kidney Health Coach welcome kits. That was to promote the launch of our updated course. But currently we don't offer, we don't ship the print materials and resources to coaches, but we do encourage you to download and print them from the free resource library that I shared, and you can use places like your local printing center, community center, or library, or a university if you're in school. And you can also always refer your community to our resource library, as all of our resources are free and they're available in English and Spanish. And I mean, right now we do have that opportunity to request copies of the AMKD resource. So we do encourage you to do that, but in general, we don't offer that other materials. I did see a question in the chat about tablecloths and like the banners and t-shirts. So right now there is you can apply for our Kidney Health Coach Health Equity Grant, which would allow you to request and receive items like a tablecloth, banner, t-shirt that you can use for your events and promote the program. And later in the meeting, we'll share the opportunity, or we'll share the announcement about the Health Equity Grants and sort of a timeline to put that on your radar in case you are interested in applying. Okay, I'm going to go ahead and check the chat for other questions. There is one from Brenda regarding the APOL1. APOL1, it was noted that sometimes it is not a good idea to take the DNA test because it may delay your time in getting a kidney transplant if you have this condition. What are the facts regarding the testing history? Ryan, can I refer this to you?
Yeah, no, I'm just rereading the question to think through a response here. I think it's a tough question to ask or to answer, and I don't feel the most confident to respond without. I think I would probably relay this to a nephrologist, and so I can work with our clinical team and get a more thorough response for you, Brenda. I know it's a tricky situation. There are some certain instances where people are afraid of DNA testing preventing them from being eligible to donate a kidney. I don't know specifically if it delays your time to getting a kidney transplant. So yeah, I will get further clarification and get back to you on that, Brenda. Thank you for the question.
And if any other coaches have questions, please feel free to add them into the chat, or if it's easier to come off mute and ask it to the team, you can do that as well.
Ryan, I will also say that, it's probably a little bit of a plug, but during Kidney Action Week, we are having a session on transplant with our new Senior Director of Clinical Education, who is a transplant nurse by trade. She might be able to give us some additional insight into the testing and maybe even the time around transplant if she has any additional information. But as Ryan said, we probably in the meantime can find some more information, but that'll be a great opportunity for us to also add in this question to that Q&A, which will take place next Friday.
Thanks, Joy. We got a question in the chat. Is there a resource with all of the links? So for AMKD, yes, there is a resource. We created a Dropbox folder, which for our coaches, which has all the AMKD resources, including the PowerPoint presentation, the collaborative call from last year about the topic, and the infographic. So we'll share that. I'll share that again in the chat. But we'll be sure to share it with coaches afterwards as well, after the meeting. And then all of the other kidney health coach resources that are available on our kidney health coach portal and resource library, which I shared earlier, and I'll drop that into the chat for you as well. And Candace, regarding your question, there was a previous question about DNA testing and how that may or may not delay your time in getting a kidney transplant if you have APOL1 specifically, and some more information about testing history and impacts it has on the kidney transplant eligibility or requirements. So we're going to kind of go into a little bit more on this topic during our Kidney Action Week, which I'll share information on later in the slides for our announcements, but there will be a session for more on that topic. Thank you. It was a really great questions. Are there any other ones?
And not that it answers the specific question about AMKD, but we do have a very extensive guide on transplant too that I just thought it would be helpful to share because it might answer some other questions people might have on the process, or it might be something that you want to share with your communities as well. So I'll just drop that in the chat for anyone that's interested.
Thanks, Ryan. All right. Well, if you have any more questions or think of anything after the call, you can always email us at education@kidneyfund.org, and the Facebook group too, to ask your questions. Thank you for sharing them, and also adding your questions ahead of time. So we're going to close out with some of our announcements. We mentioned our health equity grant a few times throughout the call, but we're excited to share we'll be announcing a third cycle starting this summer. So that should say June 2025. So we'll be opening the call for applications April of this year, and it's a one-year cycle, so it'll be June 2025 to June 2026. We'll be, like I said, we'll be opening the call for applications in April, so stay tuned for more information, including eligibility and requirements. We do encourage our coaches and organizations to apply. And if you have any questions about the grant or we do share the work that our coaches are doing or have done in the first 2 cycles. We do share that information on our newsletters and on our Facebook groups. You can kind of get a glimpse of the work they're doing through the grant. But we do encourage you to apply for the 3rd cycle, which will be opening the application for this spring. So stay tuned for that. And then we also put in a plug for Kidney Action Week. The registration is open and it's next week. Wow, can't believe it. So if you have not registered for it, it'll be happening March 3rd to the 7th. Please do so now. I'm going to add the link to register for it in the chat. It's a free virtual week-long event for the kidney community to come together, and there will be sessions on dialysis, kidney-friendly eating, transplant, and disease innovations. Well, we also have a social media toolkit, so we are asking our coaches to help us spread the word by sharing posts and images from the social media toolkit on all of the different social media channels that you are active in. And so we hope you can join us during Kidney Action Week and help us promote it as well. And Kidney Action Week always has, it's always a great event with lots of important information from guest speakers who are patients, caregivers, and healthcare professionals. We'll also have a session, a little sneak peek for kidney health coach, and we'll have our coaches on the call as well. So they'll be sharing their journey and story as a coach and encouraging others to become coaches as well. Thank you, Amma and Ryan, for adding the links to registration and the toolkit in the chat. And lastly, we'll close out with another reminder to take the evaluation. So at the end of the meeting, you'll see a short evaluation pop up on your browser. Again, I can't emphasize enough how important it is to share your feedback and input on these trainings so we can continue to offer them and improve them. We want to hear your feedback on topics that you're interested in. So please take a moment to complete it. I'll also add it in the chat and send a follow-up to all that attended today's call. So yeah, once again, it's important and it's very helpful for us to continue offering these. And with that, we're going to go ahead and close out. I want to thank everyone for joining our call today and joining the AKF team for being here as well. But if you have any questions or concerns, we're here to support you. Please feel free to reach out to us via email, or you can respond to the email I'll send as a follow-up, and we'll be sure to provide additional information or any support that you need. But thank you again, coaches, for joining today's call, and we hope you have a great rest of your week.
And before we close, I saw there was one other question from Lorna. Can a coach become a telephone support to individuals? I don't know exactly what you mean by telephone support, if you want to come off mute and elaborate, but our coaches use many different platforms to educate and share the kidney health coach messaging. So we certainly encourage whichever platform. So telephone, if that's how you can connect with people in your community, certainly encourage that.
Thanks, Ryan. Okay. Well, thank you again, everyone, for joining the call. Have a great one. Bye-bye.
Thank you.
Thank you.
Thanks, everyone. Bye now.